Hey, my name's Corey Truelove. I'm a registered nurse in Tupelo, Mississippi, and I'm going to be talking to you today about the national opioid crisis. I'm going to talk to you about opioids and what they are, what they're used for, types of opioids, opioid use disorder, the effect on the healthcare industry and patients, and what you can do to fight the crisis. So opioids, they are derived from poppy plants. They work in the brain by blocking pain sensation, and they are often prescribed after surgeries for palliative care, cancer, after acute injuries, or for chronic pain. Some of these are morphine, fentanyl, codeine, often used in cough medicines, hydrocodone, oxycodone, methadone, and oxymorphone. Some brand names are Vicodin, Duragesic patches, which is the fentanyl, Dilaudid, Percocet, or Lortab. Generally, they're used to treat pain, but they do have side effects, and these include constipation, decreased respiratory rate, drowsiness, nausea, vomiting, diarrhea, chills, and euphoria. So when you're taking these medications, you can have dependence, tolerance, or addiction. Sometimes all three, but you don't have to have all three. If you're addicted, you can be dependent and tolerant, but still not be addicted. So dependence is when you're used to taking this medication, you ended up stopping it, and you have negative effects on your body. That's what dependence is. Tolerance is when the individual is used to taking this medication so much that now they require a larger dose in order to feel the effects of the opioid. Addiction is when they have been taking this medication for so long, they're taking too much, the body is experiencing negative effects, however, they cannot physically stop taking this medication. Like I said, you can be dependent and tolerant of one of these opioids, but that does not mean that you are addicted. Opioid use went back all the way to the early 1800s, where they used it to calm teething and fussy babies, or treat women issues, health issues, childbirth, and that was termed laudanum. A lot of women and children died during this time because we did not know a lot about opioids and the effects that they had. So a bunch of women and babies, they died during this time of overdoses. After this, opioids were used a lot during the Civil War. They used morphine for injured soldiers. They used it so much that soldiers actually ended up being addicted to morphine. They termed this soldier's disease. Well, then, to combat soldier's disease and their addiction to morphine, heroin was introduced. And it was thought that heroin was not addictive, and they were going to use this for pain relief and to treat morphine addiction. Heroin actually ended up being insanely addictive. They ended up passing multiple laws to ban heroin, and initially you did not have to have a prescription, but during this time, now there were laws in place that you could only obtain opioids with a doctor's prescription. And it died down through the Great Depression, and it ended up picking back up in the 1960s during the counterculture age. There was a peak in opioid use. And then in the 1990s, healthcare providers started prescribing more opiates for pain management. This is when pain became the fifth vital sign. The Joint Commission they started focusing on the patient's pain and how it was part of the patient experience. So, during the 1990s, opioid sales rose and tripled over time. People became highly addicted to opioids because of their euphoria that they cause. So, when you misuse opioids, this is taking opioids without a prescription, being non-compliant with the directions on the label, like taking more than the prescribed dose to heighten the effect, buying medications from others, using leftover medication from past medical problems. So you can use opioids safely. And a lot of people do use them like they're supposed to, but a majority of people in the United States abuse these medications. This brings me to opioid use disorder. This is the chronic misuse of opioids resulting in negative effects or consequences. So in order to be diagnosed with opioid use disorder, you have to have two of the following. This is when the patient spends a majority of their time constantly desiring these drugs. They're seeking and or using opioids. They're increasing their dosage amount. They withdraw from relationships, from job responsibilities. They're absent at work. You could have workplace errors resulting in injury. They build up tolerance. They require higher dosages to feel the effects. And they could experience symptoms of withdrawal, which are nausea, vomiting, diarrhea, insomnia, restlessness, or agitation. If opioid use disorder is not treated, it can lead to death and or disability. So, according to the National Institute on Drug Abuse and Opioid Crisis in the United States, it costs the healthcare industry approximately $78 billion per year. This includes the employer costs of the person who is misusing the opioid, lost productivity costs due to job neglect, absenteeism, or workplace accidents or mistakes, and the medical treatment or behavioral treatment that they will require. Also, legal costs are in there. So here's some statistics for you. Approximately 25% of patients who are prescribed opioids abuse them. Roughly 10% of these patients develop opioid use disorder. 4% of people who misuse opioids transition to heroin use. Over 230,000 people have died in America from 1999 to 2018 from overdose due to opioids. And of all overdose deaths in 2018 alone, 2 out of 3 involved opioids. In the workplace, there have been laws set into effect, especially with federally funded establishments. They now require drug-free workplace programs. These entail substance abuse policies. When you're hired, you have to sign their policy saying that you agree to this. Some do random drug tests, some do drug tests when they get the job. If you're having a change of position, anything like that, they'll do a drug test. And a lot of this is providing education to employees on, the risk of opioids and how you can become dependent, tolerant, or addicted. Mostly, they want these workplaces to provide education on resources where people can get help if they do need it. So you may ask, how do we as healthcare providers combat this threat? Well, healthcare physicians should sit down with their patients and they should establish goals and expectations of treatment, what the patient expects, and how they're going to initially begin treating their pain. So first they need to try non-pharmacological methods like acupuncture, meditation, try repositioning, physical therapy, decreasing stimulation and promoting relaxation. And sometimes you can treat the cause, because the cause of the pain, if you treat it, the pain will go away. And secondly, you want to try non-opioid medications such as anti-inflammatories, Tylenol, ibuprofen, or things like that. If you do end up prescribing opioids, you want to start at a very low dose and go slow, increasing to obtain the lowest efficient dose. You never want to prescribe extended release medications for someone who is in acute pain. That puts them at risk for developing opioid use disorder and then becoming addicted. So if you're not in the medical field, you should not want to initially start with an opioid just because they have a high risk of abuse. Never throw your medications that you don't use in the trash. If you want to flush them, that's good. You can dissolve them in kitty litter if they're liquids, or you can take them to your local pharmacy for proper disposal. Never share your opiates with anyone else, and be aware of resources in your community to help fight this epidemic. Some resources for help are the Substance Abuse and Mental Health Services Administration has a 24-hour hotline that you can call 24 hours a day for help. You can also go to the National Center on Addiction and Substance Abuse at www.centeronaddiction.org for information and resources. You can go to the U.S. Department of Health and Human Services site at www.hhs.gov/opioids for more information on how to combat drug addiction. And if you are struggling with drug addiction, you can always go to your physician, you can talk with a counselor, but know there is always help. So this is the end of my presentation on opioids. Hopefully that you have learned something that at least you did not know, and you can educate others on the importance of combating this epidemic, because too many lives are lost every year to opioids, and I hope that we can find a way to, stop this epidemic, because we need to do better. Thanks.